I think it's important for the corporate sector to engage in health because health is a driver of economic development. And for Pfizer, we engage in it because it aligns with our business purpose. We're supposed to discover, develop, and bring to market medicines that meaningfully improve people's lives. And so therefore, we have a vested interest in building healthcare infrastructure globally. Pfizer is committed to, like most partners, to achieving the Millennium Development Goals. And we, of course, are involved in certain goals more than others. But broadly speaking, we're committed to ensuring access to medicines and healthcare for those in need. And we do that through three primary mechanisms. First, we're always working to develop creative commercial strategies to reach more patients with our medicines. Second, we have unique global health partnerships that allow us to have both commercial transactions as well as donations to ensure that patients have access to our medicines. And finally, we invest heavily in traditional philanthropic partnerships, which we call social investments, that are designed to improve the healthcare infrastructure in totality, from both the medicine delivery all the way through to infrastructure and, of course, treatment and prevention. The Global Health Fellows Program is a crown jewel of our social investment strategy at Pfizer. It's our 10th year anniversary, and we launched the program in 2003, initially to address the growing HIV/AIDS epidemic. We donate the time and the talent of our employees for up to 6 months, working with non-governmental organizations addressing healthcare issues on the ground. Fast forward 10 years, we've got a more focused program working in East Africa, China, and India on access to health issues that fall into three categories. Supply chain. Pfizer knows a lot about how to manage a supply chain, ensure that there are not stockouts and there are access to medicines across that supply chain. In prevention of disease. And the third area in business development. So we know that we have skills that our NGO partners need as they think about expansion and reach to more patients. So we support our fellows' partnerships with these NGOs on the ground working in these three particular areas. Pfizer's business has really benefited from the Global Health Fellows Program. We have learned so much more about growing emerging economies, markets that really are going to matter in the future. We deploy our fellows there. They have the opportunity to see what the patient experience is on the ground, and they bring that knowledge back to Pfizer. They also bring knowledge of the regulatory environment and what the entire healthcare infrastructure looks like on the ground. That allows Pfizer to grow and develop business strategies that address those needs on the ground. In addition, we support the engagement of our fellows in a leadership and in what I call cultural flexibility. We are a global company operating in more than 100 countries, and we need colleagues that understand and appreciate cultural difference and work to develop leadership skills at all levels. So we believe this particular program has allowed us not only to get to know our markets better, but to support our employees more directly. We've had a lot of great success with the program, and over time we've continued to focus on impact and expansion. I'll give you one example. In India, we had a partnership with Christian Medical Hospital, and at that hospital we had more than 14 fellows participate. And what we were able to achieve was getting 2 certifications for the hospital that allowed them to get more resources and treat more patients. And these are actually quite difficult certifications to receive, and those fellows had a direct relationship and impact in allowing the organization to achieve that level of credibility. And we've also done things like work in East Africa and Kenya to solve supply chain issues with farm access. And we've helped Mothers to Mothers in South Africa expand exponentially their reach to more women and children with HIV.